Calcium, the most abundant electrolyte in human body. Dietary sources. Milk and milk products are the best dietary sources. Other good sources are egg yolk, leafy vegetables, hard drinking water, or betel leaves. Recommended daily allowance. As per day recommendations, infants 400 to 600 milligrams, children 800 milligrams, adults 1200 milligrams, and pregnant and lactating women require 1200 milligrams. Body distribution. Plasma calcium level is around about 9 to 11 milligrams per deciliter. RBCs contains a very little calcium, about 0.0%. Bones have more than 99% calcium in the form of phosphates and carbonates. Bone calcium is constantly exchanged with the calcium of intestinal fluid, and this process is regulated by the parathyroid hormone, active vitamin D calcitriol, and by calcitonin. Serum calcium occurred in two forms, non-diffusible and diffusible. Non-diffusible calcium, this fraction of serum calcium cannot be dialyzed out. Its normal range up to 3.4 to 4.4 milligrams per deciliter. Non-diffusible calcium combines with plasma proteins. 3 milligrams per deciliter bound with albumin and 1 milligram per deciliter bound with globulin. Non-diffusible calcium level is dropped in hypoproteinemia. Diffusible calcium. Diffusible calcium fraction. This fraction can be dialyzed and it have two types, ionized calcium and complex calcium. Ionized calcium is physically active calcium. Its normal range 5.45 to 6.23 milligrams per deciliter. Its level increased in hyperparathyroidism and decreased in hypoparathyroidism. Tetany may occur if the level of serum ionized calcium falls below 4.3 milligrams. Tetany, increased neuromuscular irritability, manifested as carpopedal spasm or laryngospasm. Tetany cause may be due to a surgical removal of parathyroid hormone or by autoimmune disorders. Biochemical manifestations of tetany: calcium decreased with a corresponding increase in phosphate level. Urinary excretion of both calcium and phosphorus decreased. Treatment: given intravenous injection of calcium salts. Complex calcium. Normal value less than 0.6 milligrams per deciliter. In complex calcium makes a complex with a plasma anions, for example citrate, phosphates, sulfates, and bicarbonates, etc. Absorption. Calcium absorbed in inorganic form. Absorption occur in proximal part of the small intestine where absorption is made by an active transport mechanism. A small fraction About 5% of calcium absorbed, especially in distal segment of the small intestine, involves facilitated diffusion. About 240 milligrams calcium absorbed per day. Absorption occurs in two steps. Number 1. Uptake of calcium at mucosal pole followed by the calcium specific channels, carriers or transporters. Number 2. Efflux of calcium at the serosal pole of the intestinal epithelium, which followed by the calcium magnesium ATPase or calcium pump. Look at the figure that how shows that how the calcium absorbed. Figure of enterocytes in which the dietary calcium they internalized by the help of calcium transport calcium transporters. Calcium is brought into the enterocytes from these transporters and bind to a protein called calvadin D. This allowed to transport calcium through the enterocytes to the bloodstream by the help of ATP-dependent calcium pump. The question arises here that why calcitriol is so important in calcium absorption. The answer of this question is calcitriol enters in the enterocytes and binds with a cytoplasmic receptor, vitamin D receptor, which is also called a transcription factor. Calcitriol internalizes in nucleus just like another steroids hormones and activates genetic program. After activating genetic program, it increases the expression of calcium transporters that allows to intake a maximum calcium inside the enterocytes. Calcitriol also increases the expression of calvadin D protein to accept a maximum calcium molecules and able to transfer from enterocytes to bloodstream. Calcitriol also increases the activity of ATP-dependent calcium pump. This allows to move the calcium from enterocytes to bloodstream by the help of ATP-dependent calcium pump. That's how the calcium absorption occurs. Here are some factors which affect on calcium absorption. These includes number 1, vitamin D. Active form of vitamin D, calcitriol, increase calcium absorption by increased amount of specific transport proteins called calcium transporters which are responsible for active transport of calcium in enterocytes. Number 2, parathyroid hormone. Parathyroid hormone increase calcium absorption mediated through the conversion of vitamin D into its active form calcitriol. Number 3. Calcium phosphate ratio in the food. For an optimum calcium absorption, this ratio should be within the limits 1 to 2, 1 by 2 to 2 by 1. Excess of phosphorus in the GI tract decrease the calcium absorption. It means if phosphorus is excess, there will be a decreased absorption of calcium. Number 4. Presence of free fatty acids. When absorption of fatty acids are impaired, then the unabsorbed fatty acid react with free calcium to form insoluble calcium soaps. Results calcium absorption interfere and it decreases the absorption of calcium. Number 5. Bile salts. These bile salts increase the absorption of calcium by an enhance the solubility of calcium salts by increasing vitamin D absorption and by increase the digestion and absorption of fats. Number 6. Presence of anions. Anions like oxalates, carbonates, sulfates, and phosphates inhibits calcium absorption because calcium salts of these anions are highly insoluble. Excess of phytic acid, which more abundantly found in unrefined cereals, have the same effect. Number 7. Proteins in diet. Proteins facilitates calcium absorption because amino acid salts of calcium are soluble in aqueous solution of amino acids. Number 8. Intestinal pH. An acidic or less alkaline pH of the intestinal contents favors calcium absorption. Lactose, the milk sugar, facilitates calcium absorption by increased acidity of intestinal tract because some of the lactose should be converted into lactic acid, which causes increased calcium absorption. Number 9. Calcium deficiency or calcium deficient diet. Increased absorption of calcium occurs in calcium deficiency or calcium deficient diet because it mediates through activity of parathyroid hormone. Number 10. Calcium intake. If calcium intake is more, formation of active vitamin D decreases and relatively less calcium is absorbed. Reverse is the case with a low calcium intake that increases the calcium absorption. In excessive calcium intake results calcium toxicity that causes hypercalcemia, nephrocalcinosis, renal failure, and hypertension. Old age. In old age, less calcium is absorbed. Glucocorticoids. Number 12. Glucocorticoids decrease the absorption of calcium because it interferes its absorption. 13. Intestinal diseases. Diseases like steatorrhea and chronic intestinal malabsorption decrease the calcium absorption. 14. Idiopathic hypercalcemia. In this condition, calcium absorption from the intestine is greatly increased without any known reason. Now the factors affecting the plasma calcium level, or we may call the factors that regulate the blood calcium level. Amount of calcium absorption from GI tract. Amount of calcium absorbed from GI tract influenced by many factors. The amount of calcium absorption decrease in the presence of free fatty acids. The amount of calcium absorption increase in the presence of bile salts. The amount of calcium absorption increase by Proteins and amino acids and the amount of calcium absorption increased by acidic pH of intestine, etc. Now, parathyroid hormone. Parathyroid hormone increased intestinal absorption of calcium. It also mobilized excess calcium and used marked hypercalcemia is induced. This effect is brought about by an increased osteoclastic activity as compared to the osteoblastic activity. It also increased calcium reabsorption from the distal convoluted tubules of the kidney. Now, inverse relationship between plasma calcium and inorganic phosphates. Increase in plasma calcium level, fall in plasma inorganic phosphate. Plasma calcium decrease in kidney diseases due to a more retention of phosphorus, which leads to an increased plasma phosphorus level and hypocalcemia is seen. Now, plasma protein level. Each gram of plasma proteins like albumin and immunoglobulins bind round about 0.84 milligrams of calcium. This situation in hypoproteinemia results decreased level of bound calcium. So, a decrease in total serum calcium is found. Renal excretion. Normally small part of calcium excreted in urine, but if excess calcium is administered, more calcium is excreted in the urine. By diuretics, renal loss of calcium increase if more sodium is being excreted in urine by diuretics. Now, calcitonin. Calcitonin, a peptide hormone produced by the parafollicular cells of the thyroid gland. It decreased the plasma calcium level as it antagonized the action of parathyroid hormone. Calcitonin decreased bone resorption and increased the deposition of calcium in bones. It also increased the urinary loss of calcium by inhibiting the calcium reabsorption in the proximal convoluted tubules. That's all about calcium.